Thanks, Simon. Well, earlier in the programme, we spoke with mum of 3, Michelle Bradley, who battles with crippling anxiety and depression. And lots of you have been getting in touch to share your own stories. You've also been sending in your questions and concerns, and psychotherapist and cognitive behaviour therapist Susie Ladola joins us now to help answer those queries and to put you at ease, because I'm sure so many women watching, or even partners, other mums of daughters, you know, this will have resonated with so many of our viewers. So let's go into this first question. Very interesting. How do I ask my wife about postnatal depression? We had our first baby 4 months ago. My wife has taken it all in her stride, but recently I've noticed her behaving a little strange. I woke up the other night, she was sitting in the chair beside the cot watching our baby. When I asked her was everything okay, she said she was afraid our baby would stop breathing. Another occasion they were to go out to lunch. She didn't want to go because she was scared the baby would catch a disease. I'm worried she's not doing well, that she is suffering silently with postnatal depression, and how can this husband get his wife to open up to her?
Okay, that's very common. And what I want to say, first of all, to Michelle, it's fantastic that she came forward and brings the topic into the domain of public debate and bringing it out and making it normal. Because a lot of women are really afraid to acknowledge that they have postnatal depression. And I take that question that you just read out here, is that that mom probably feels there's something not right, but she might be afraid to talk about it. And her husband, it's great that he's actually aware, because that's what we will say to people as well, is talk about postnatal depression while you're pregnant. You know, in antenatal classes, bring it out into the open, discuss it, you know, make it a topic that is just as normal as giving birth or what's happening after with the baby. So the husband is not tuned in, and it's so important that the mom has support from people that are close to her. And he's now picking up change in behaviour, which is a sign of there could be something going on there, and that the mom is not even aware of it. So she's starting to change her behaviour because her thought pattern is changing. She might start to worry about, like, sitting over the child, watching the child, worried that something will happen. So therefore her anxiety levels are raised, and then that changes her behaviour because she's having different kind of thoughts. She might have...
I think as mums, all of us have checked if the baby is still breathing at some stage or another, even if it's not your firstborn, you check. So how do you know when things are more serious, and that, you know, just a concern is then becoming irrational, and actually it's not just a baby blues, or it's not just concern?
Well, look, the baby blues happens after day 3 or 4, lasts a few days, and then it stops. Whereas postnatal depression may start even a little bit later, and it continues. And it's really important as well to detect it really early, because the sooner you detect it, the quicker you can be helped and the quicker you're getting over it. But unfortunately, a lot of women are afraid to come forward and say that they're not feeling right, that there's something not right, that they're, like, excessively watching the child, or they're stopped doing things they enjoy, or they want to stay at home and they don't want to do things. Total change in behaviour that's not typical to what the mom was beforehand. So to get help really quickly is encouraging the talks like you're doing here now. But like I said, women are afraid to come forward as well, because they're worried about the child might be taken from them. They're worried about, being stigmatised, being looked at as a mental health issues, and you know, it's sad, really. And that's why, if you're having the discussions with your family, with people closer around you... And how can this go?
Because, you know, you feel like you're failing as a mum a lot of the time. And if someone comes to you and say, I think you're suffering with depression, I can imagine you'd be defensive and go, hang on a second, I'm handling this as best as I can.
Exactly.
And so how do you open up the dialogue?
How you open it up is say, look, I've noticed that you've changed things, the way you're doing things. I've noticed you're doing watching the baby a lot. And are you worried? And just ask the question, how do you feel? Do you worry about something? What's going on? What are you thinking? Is there anything I can help you with? And you don't have to go straight away and say, look, I think you have postnatal depression. But starting gently to ask around, you know, how are you feeling? How are you sleeping? You know, new moms don't get a lot of sleep, and dads as well. So that would just make it worse again. And he's there for her. And, you know, I put this out on my social media last night, that I'm doing this today. And I was inundated with private messages. I asked, has anyone had an experience and what has helped? And the majority came forward and it said people close to me supporting me, and also going to counselling for cognitive behaviour therapy, because that helps. You know, it's a gold standard therapy for any anxiety disorders, which postnatal depression is part of that. You know,
and it works. You know, the outcomes are always good. good. Next question from a viewer. I'm terrified I'll get postnatal depression and anxiety again. I had my first pregnancy. I'm currently pregnant, terrified again. Is there anything I can do to ensure I don't suffer the same way I did first time around?
Yeah, so that's typical. It's your thoughts are starting to cause the anxiety. So CBT is about your thoughts cause your feelings and your behaviours. So if you're thinking about, I'm terrified, something bad is going to happen, maybe the baby is going to have problems, maybe I'm going to die, these sort of thoughts, and Michelle was even saying that as well, or the thoughts she was having. So what that happens, it triggers the fight or flight response in your body. So you're getting anxious, and then you're starting to worry about getting anxious, and you start to worry about the symptoms of anxiety, and you go into full-blown panic attacks. So the trick here is to understand, first of all, understanding that it's your thoughts that causing the anxiety. Understanding it's normal to have kind of concerns, and it's normal, and it's also to think, you know, a lot of women would catastrophize, or they're thinking, should and must, I should be the perfect mom. And so next door neighbour, look at her, she's perfect, she looks fantastic, the kids are in the park at 10 in the morning, why can't I go do that? And these type of thoughts cause the anxiety, you know, and the types of thoughts of, I should be doing this, I should have the house clean, I should have the dinner on the table, I should look fantastic, I should be with the kids in the park and doing all of these fantastic things that everybody else seems to be doing, only I can't do it. So shame comes into it as well. People, you know, women are ashamed, why can't I do that? And coming back to the first question, you know, it's where the husband is inquiring, it's about telling the wife, she's doing a fantastic job, you know, and it's okay. Just let everything go.
Is family support enough, do you think? Or should a mum go to your GP and have a chat with them?
Absolutely.
Okay.
Always, you know. Talk to as many people as you can. That's what I would say. Talk to your family, talk to your friends, talk to support. There's support groups. Michelle was saying about a Facebook group. Find the connection somewhere, you know.
Just on that, another viewer came in. I know I'm skipping down to our fourth question. She's asked, I've been feeling really down since the birth of my baby. I tried to talk to my mum about it, but she told me to pull myself together. That it was just a case of the baby blues. Maybe she's right. Maybe I'm overreacting. Every day feels like a struggle. Our baby's very colicky, doesn't sleep well at night. As a result, I've had a lot of sleepless nights. My husband works abroad a lot, so I'm on my own a lot during the week. Am I just exhausted? That does not help when someone tells you, get over it, you'll be grand.
Absolutely not. There's no way that, you know, that makes her even feel worse, because now she's now believing, I'm actually not good enough.
I'm failing again.
I'm failing at this, exactly. So it's really, the first thing is to understand. It's your thoughts. You're thinking in a way of, I'm not good enough, I'm failing, catastrophizing, I should be doing, I must be doing. And if your mom isn't there, if you don't have support around it, go to your GP, talk to your GP. And, you know, the question is often, do I need antidepressants?
Yes.
And your GP will be best positioned to decide that. But in my own personal opinion, is I wouldn't take that as your first-line treatment. I would take CBT or some form of counselling as first-line treatment and discuss it and see how you go. And I often work with GPs together. So, you know, I get permission from my clients to talk to the GP and coordinate treatment, you know. So sometimes antidepressants are necessary in order to engage in therapy, because you may be so low that you actually can't engage. But most of the time you don't. You know, you can come to therapy, and after a few sessions, once you start to understand how your brain is working, how your physicality is connected to your brain, once people understand that, they actually start to feel better already.
You can really get a handle. I'm sorry, we're going to have to, we could talk all day. There's so much in this area. But basically, things work out. You know, this works.
Yeah,
and
you can get better.
And
talk to people.
Keep talking. All right, time for a quick break. We'll see you after this.